It's common to feel uncertain about using iCBT with patients for the first time. You may have questions about supervising a patient through the course, risk management, and how a digital mental health intervention can fit within your scope of practice. At This Way Up, the safety of your patients is a priority we share with you. In this video, we'll explain how to supervise a patient through a This Way Up course, as well as how distress and safety issues can be managed. The courses are self-guided, meaning your patient will be able to complete each lesson independently. As their supervising clinician, you can provide more individualised guidance and support when needed. For example, you can help your patient tailor a skill they learn in the course to their particular situation, as well as keep an eye on their functioning throughout their online treatment. We often get asked, who can supervise our courses? Basically, any qualified health professional already supporting the mental health and well-being of a patient is able to recommend and supervise patients through our programs. So if you're a nurse, social worker, counsellor, psychiatrist, psychologist, GP, or other allied health clinician, you can supervise our courses to your patients. Once you've completed your own assessment and made a collaborative decision with your patient to enrol in a clinician supervised course, you can then register as a clinician and send a registration email to your patient. Please see our video instructions on these steps linked at the end of this clip for more information. After your patient has registered and started their course, your Clinician Dashboard will keep you informed of their progress along the way via their automatically generated patient record. To have a look at your patient's progress, simply log into your Clinician Dashboard and select the patient record. You'll be able to see how they are tracking, as well as the different questionnaires they've completed throughout the course. Here's the view of the Clinician Dashboard for Kate, who is completing the Mixed Depression and Anxiety course. You'll be able to see when Kate completes each lesson and her scores on self-report questionnaires. There is also information on the left-hand side underneath the questionnaire title. You simply select the eye icon for detailed information regarding the questionnaire and how to interpret your patient's scores. Your patients will complete self-report questionnaires at the beginning, middle, and end of their course to help you monitor progress, distress, and risk. The K10 questionnaire, a measure of psychological distress, and the PHQ-9, which assesses symptoms of depression, are included in all the courses. Depending on which course your patient is completing, other symptom-specific questionnaires will also be included to track symptom change. If your patient scores highly on a measure of psychological distress and/or indicates thoughts of self-harm or suicidal thinking, this will prompt our automated alert system to provide crisis support numbers to your patient, as well as inform you of their high scores. The patient will receive an automated email telling them they've scored highly on a measure of distress, or that they've indicated they're having self-harm or suicidal thoughts. The email will include some crisis helplines. They'll be encouraged to make an appointment with you if needed, present to hospital, or contact emergency services if they're acutely at risk of harm. Please note that the crisis helplines are for Australian residents only. As their supervising clinician, you'll receive an automated email alerting you of your patient's high distress scores. The email will include a link encouraging you to review your patient's scores. After clicking this link, you'll be taken to the Clinician Dashboard and will see a red alert on your patient's scores. Once you click on this to review the scores, you can then use your clinical discretion, based on your knowledge of the patient, about what action, if any, to take. After you review the scores, the record will no longer be highlighted in red. You'll see a small red icon that will remain throughout the duration of their course. This is to help you when glancing at their questionnaire scores to see which ones indicate high distress and when, as a quick method of tracking progress and change. Please do be reassured that if your patient scores are elevated, they have been encouraged to seek additional supports if needed. The alert system is designed to help keep your patient safe, as well as keep you informed, not alarmed. For more information, we encourage you to read through the Terms of Use for Clinicians and Information for Clinicians documents. We also have clinician-to-clinician support available Should you have any questions, please get in touch with us at contact@thiswayupclinic.org. For step-by-step instructions on how to register as a clinician and send a registration email to your patient, please watch our video here on how to register a course for your patient.